Let me introduce our expert, Professor Igor Bondarenko. Professor, could you tell us something more about you, your profession, what are you doing?
Well, hello everybody, and thanks for having invited me here. Basically, I'm a medical doctor with a further specialization in biochemistry, then clinical chemistry and laboratory diagnosis, and some other particulars of a medical practitioner. But biochemistry is really the area of my deep search and even everyday practice. Later, it moved into the reign of nutritional biochemistry, which might be even more interested as an applied science.
Okay. There is a reason we're sitting here. This looks like an aeroplane. So we are here in oxygen chamber, or how would you call it? We call it normobaria, hiperbaria. Is there any difference between those chambers, and is it also it makes us more oxygenated?
Well, obviously this chamber is designed for normobaria, in fact, and the difference between them, normobaria and hiperbaria, is technically in the level of atmospheric pressure under which oxygen is supplied to the chamber. So that one is, as far as I know, supplying oxygen at the pressure of about 1500 hectopascal. Hyperbaria or hyperbaric chambers provide oxygen at a higher pressure. It all depends mostly not just on the technical capabilities of the chamber, but rather on the needs with which people are coming for improving their health. Normobaria is the one which usually works as a stimulant of immune response, as a stimulant of repair processes, a stimulant of the overall work of the brain. Athletes come for having their muscular activity stimulated. But all in all, normobaria is a nice mild stimulant for the basic metabolic processes in the body. It is believed that normobaria and hiperbaria are able to increase the level of oxygen in our tissues, which still requires proper instrumental research and measurements. We have quite limited possibilities of utilizing more oxygen and transporting it to the tissues, but what the procedures certainly do is they work as a trainer. With providing more oxygen, they stimulate our ability to utilize oxygen and resist the possible side effects of the contact of oxygen with our tissues.
So that's very important point to make, that the chamber does not increase the level of oxygen, right? Or
it does increase the level of oxygen in the inhaled air. So more oxygen is coming into the lungs. But then the issue is how to arrange it in such a way that the more oxygen from the air which we breathe in comes to the tissues. And for this, the body has quite sufficient barriers. And even in the lungs, coming or accepting more oxygen in the respiratory tract finally stimulates the production of some lipid molecules by which we are protecting our lungs from oxidative damage. So this extra oxygen works as a trainer. works like
so we are sitting in training chamber.
exactly
Like
and
this.
we train almost every cell of ours, because having more oxygen in the air which we are breathing in is not a normal condition. This is kind of an exercise for the body. And the first thing that the body produces in response to such an over-oxygenation is it produces more antioxidants. So in other words, normobaria or hiperbaria, they both stimulate the production of the substances by which we are protected from oxidative stress.
Okay.
And this is the way how the tissues get healthier.
Okay, so are there any medical conditions that we can recommend the chamber, the people with those illness should use the chamber? Is it like general recommendation we can make?
Certainly. Well, an extra production of antioxidants is required when we are under a condition or in a condition of oxidative stress, which means ideally people who are working at bad or dangerous professional conditions should come here often, because they may be working with chemicals, they may be breathing toxic gases, they may be working with the vapors of organic solvents or whatever. In order to cope with that, the body needs more antioxidants.
More protection.
More protection, exactly. People with chronic diseases of the respiratory tract. Why do we have chronic inflammations in our inflammation in our respiratory tract? Simply because, this is one of the reasons for it, the lungs do not produce enough of the so-called surfactant, the phospholipid, which protects us from danger which we may breathe in. By oxygenation, the lungs begin producing more surfactant, and we get more protected against toxins which we may breathe in. Cardiovascular problems. With all kinds of cardiovascular problems, the tissues to which our cardiovascular system delivers oxygen, they are devoid of antioxidants. And when the tissues have less antioxidants, they themselves start producing more free radicals. And producing overproduction of free radicals means making the disease even more severe. We should
have a kind of protection of our body, or make some blood test or examination before using the chamber, or it's who should tell us to use or not use the chamber?
Usually this is a piece of advice from a person's medical doctor, and usually medical doctors accept oxygenation procedures very positively, and this is good, even though they may have different concepts of why and how this procedure works, but still usually medical doctors, consultants, even private practitioners, they approve it. And they see if a person is requiring a mild stimulation of their immune response, of their repair processes. For example, if a person is having a long healing wounds, in this case, a little bit more oxygen in the breathed in air would stimulate wound healing. Even so, surgeons, especially surgeons of the elder generations, they recommend it a lot, and they are perfectly right. There is no danger in it, and unfortunately no specific laboratory tests will tell tell you that, say, that particular person is highly recommended to visit a chamber, and that person is better to be said about contraindications. No. Lab tests do not exist for that, even though they can be created and elaborated, but that's a special issue. But usually a clinical experience of a doctor is enough to say, yes, it is better for you to try this. And people, even without a medical consultancy, can recommend this to themselves, okay, simply to keep up.
So, in general, we could say that normobaria is good for people with cardiac problem, with people with lung problems, with people with chronic disease, for people with wound healing problems. What else are the people who can use the chamber?
Some people even mention that staying in such a chamber for a couple of hours stimulate their intellectual abilities. Even the brain begins working faster, more efficient. So, usually when the body, including the central nervous system, the immune system, when the body needs a mild stimulation, there is an indication for oxygenation.
So, is it any possibility to make the usage of chamber more efficient? I mean, is there anything else to change, for example, the food, the lifestyle habits, or the supplementation to make the usage of chamber more efficient?
Certainly. Certainly. The less inflammation the body has, the more susceptible it is to oxygen. And unfortunately, most of us are in the status of a chronic inflammation most of our lives. Very much unfortunately. This inflammation comes from, like you said, improper lifestyle, improper food. The commonest reason for stimulating inflammatory processes is the excess of carbohydrate in the diet, which is so common around. People eat sugar or pour the sugar on their bananas or dates and drink Coca-Cola afterwards. So this is obviously an overload of the body with sugar, and not just sugar. What is even worse as a potential, say, carbohydrate toxin is fructose when it is in an excess. Not just the fructose which a person can consume from an apple or pear or berries. No, the fructose which the body receives in an excess. And this is actually happens when people use the sweetened carbonated drinks.
There is a lot of glucose syrup.
Yes. Some of them contain glucose, but mostly they contain what is called high fructose corn syrup. And this high fructose corn syrup is used not for the benefits or for the health of a consumer, simply because it is cheaper than sucrose or table sugar. This is it. Quite often, strangely but true, quite often people overreact to gluten. And it does not mean that everybody sitting around has a celiakia. No. The condition which is not taken by many Western doctors is named a non-celiac gluten sensitivity. And this comprises quite a big proportion of the population. So gluten is not as good as we used to think.
There is no specific method to see, to treat, to diagnose non-gluten celiac disease? Is it true or not?
Laboratory tests for that, laboratory confirmation for that, unfortunately, have not been developed yet. So the key for detecting this non-celiac gluten sensitivity is just a clinical experience. If a person or if a physician suspects that a person may have this condition, a person is recommended to get rid of gluten, but totally, entirely, for say 2 or 3 weeks and see what happens. If there is a dramatic improvement in the condition, and usually it means a drop of pain in the joints, getting much more flexibility in the spine, improving sleep, removing headaches, and so on and so forth. After such a stable improvement, doctors may recommend to a patient, if this improvement is not enough for the patient, doctors may recommend to a patient to get back to gluten. Quite of a, I couldn't call it a sadism, but something very close to it. Very soon after getting back to gluten, patients feel worse again. So the non-celiac gluten intolerance is a diagnosis which is set on the basis of the lack of laboratory indices of celiac disease and the clinical effect from abandoning gluten, especially if a return to gluten causes worsening of the conditions. So not for everyone ordinary pszenica, żyto, owies, jęczmień, not for everybody, they are really good. We have to consider
or really
it.
bad.
Indeed. As for supplements which you mentioned, yes, indeed, there are supplements which can increase the effectiveness of oxygenation, normobarii or hiperbarii, anyway, oxygenation. And the first thing that has to be mentioned is magnesium. Magnesium is a mineral that is required for over 600 enzymes in our body, including those which are involved in producing antioxidants. Because some of antioxidants we can produce in our body. Some we have to eat, we have to receive it from the food. Magnesium improves this. Magnesium improves blood circulation. Regardless of the amount of oxygen that the blood vessel can transmit, magnesium prevents the platelets, płytki krwi, from excessive clogging. And by this it improves circulation in the organs. Magnesium is excellent for helping the organs which often suffer from hypoxia or the oxygen deficiencies, and those are heart muscle, those are kidneys, and the liver. So magnesium is quite a universal.
And we must say also that a lot of people is deficient with magnesium. Like the blood test cannot tell us about the amount of magnesium in our body.
Exactly.
But we need this mineral for our body, and it's difficult to assess to make the assessment of this mineral.
It is you are perfectly right. It is quite correct that serum level of magnesium very often doesn't show anything. People may have heart attack, people may have a stroke, people may have an ischemia of the intestine, people may have quite bad, complicated diabetes, and still the level of magnesium would be in the so-called reference range or normal range, because the serum contains 0.3% of the total magnesium of the body. and there is no correlation, no straight connection between the level of magnesium in the serum and in the tissues.
And is there any difference between tablets of magnesium and liquid magnesium?
Definitely, yes. Because the efficiency of magnesium, of a given magnesium product or preparation, depends not only on the amount of magnesium in, say, 1 gram of the product. Not only we have to take this or that kind of magnesium, we have to absorb it then from the intestine, transport it to the tissues, and utilize then from the blood. In other words, we are talking about bioavailability, the availability of the tissues to receive the required magnesium. Tablets are easiest to produce, but tablets often have some binders, fillers, colorings. Tablets have shell, tablets have sweeteners and other substances which reduce the bioavailability of magnesium.
And they are really short with the bioavailability of the mineral.
Perfectly right. They may be very cheap. Cheapness means being available for everybody, but if this cheap tablet contains, for example, tlenek magnesu, this one does not dissolve in water, and therefore it does not dissolve in our intestinal juices at all. So it stays in the intestine almost like a sand. The body is not able to take it.
So make our intestines more rich.
Yes, for a while. Yeah. Capsules are better, but still capsules often contain fillers, and those fillers often are not neutral. Paradoxically, capsules often contain the so-called magnesium stearate, the filler. Magnesium salt of a stearic acid, and stearic acid is a long chain carbon acid which can be easily found in the candle wax. So a magnesium salt of the candle wax. Can the body take magnesium out of the candle? No. So ideally, an ideal form of magnesium is, of course, an aqueous solution. A solution of magnesium, different kind of magnesium, in the water. For this, to take magnesium out of this solution, the body does not need to apply too much force and too much energy.
And what about the dosage? Because a lot of patients see the recommended daily intake, and when they see that there is 100% of magnesium, they pick those pills or supplements. We already established that capsules and tablets are much worse than the liquid forms. But what about the dosage? Is it very important to bring 100% at once of magnesium, or it's better to divide it for couple dosage?
Well, first, capsules and tablets are not more dangerous. They are quite often more useful than the solutions. The dose, the required dose is of course better to be divided into several intakes, at least into 2 intakes. Sometimes if a person is able to do it, 3 intakes are even better, because even if magnesium is in a highly bioavailable form, you take the daily dose, it is absorbed in the blood, and if the body does not need that amount of magnesium at this particular moment, it just removes the excess through the urine. So it's better to give it in, like if you are hungry, you are not supposed to eat all your daily meal in one shot. Better to have breakfast, lunch, dinner, and then supper. So it is with magnesium.
What other supplements we could say that can make the usage of chamber more efficient?
If we talk about minerals first, that could increase the production of antioxidants in the body. It should be zinc and it should be selenium. Selenium is an antioxidant itself, but more important is that zinc and selenium increase the production of enzymes which have antioxidant activity. So they are perfectly friendly with magnesium, and they are perfectly friendly with each other, and also would be excellent if they are produced in the form of a water solution. Other things that could increase our antioxidant potential are, for example, alpha-lipoic acid, kwas alpha-Tlenowej, which is important for binding and removing some toxins, and for the work of an enzymic system which then produces the chemical form of energy, our ATP, adenosine triphosphate. The more ATP we produce, the more resistant we are to all kinds of stress. And we cannot take ATP in tablets or even in a water solution because we need to produce a lot. We can stimulate the production of our ATP. Alpha-lipoic acid is an excellent help with that. Another one, which is say, synergistic to alpha-lipoic acid, is vitamin B3, niacinamide. This one helps the body to make more ATP, and this works as an kind of an antioxidant itself. If people still want to increase their abilities, and if they are coming to oxygenation, having some chronic cardiovascular problems, it's better to additionally protect their heart with, for example, coenzyme Q10. This is good.
So there is quite huge range of supplements that can support our health and the efficiency of chamber usage.
True.
Is it very important? Like it can double the effect, or it can we assess in some way the efficiency, or it's really difficult and impossible to make that assessment?
Not so many specialists, unfortunately, are thinking now of combining oxygenation and supplementation. So perhaps the best judges for the efficiency of such a combination is people themselves. If they are coming for oxygenation, oxygen therapy, normobarii or hiperbarii, for example with diabetes, and if they see that after several sessions of oxygenation with magnesium, their blood sugar level is much more stable and it's much lower than it used to be, fine, it means it works. If people are coming with high blood pressure, and again with magnesium, zinc and selenium and might be something else, they see that their blood pressure decreases, and this decrease is stable. This is the best proof.
This is the best proof.
Yes. So we are not aiming at particular, say, numbers, particular kind of ometry or ography, because the most important treasure is the person's health. If people are feeling better, if people have the indices of their main diseases decreasing, this means an effect.
So, in general, we can advise or just recommend the patient, all people, to check the oxygen or normobarii, it's the better name for this kind of chamber, to use and to see how does it work for you.
Indeed. I would love to do it myself.